Hi everybody, we're here at the AAO conference. I'm here with Dr. Jeremiah Brown. Hi.
Hi, how are you? It's good to be here.
Good. Tell us a little bit about yourself and about your practice.
Sure. So I am a retina specialist in San Antonio. We do all phases of retina, diabetic retinopathy, macular degeneration, patients with retinal detachments. I did spend some time in the military, which is what brought me to San Antonio, so that was a good experience. I grew up in Connecticut, a small town. Kind of had a chance to live in several different places through my training and ended up in San Antonio, so happy to be there.
Great. Have you been to this conference before?
I have.
Great.
I enjoyed it a lot.
Nice. What have you taken away from the conference?
Well, you know, the biggest point I would say is there is so much research going on from the standpoint of how to treat macular degeneration, how to prevent it, can we do better with our patients who have diabetic retinopathy, and what are the new treatments that are coming down the pike. I think that's the big take-home point.
What are some of the newest trends?
So the big thing is now we have very good ways to stop abnormal blood vessels that grow in the eye with diabetes or macular degeneration and bleeding that happens, but there are other aspects that we don't really have good control over. Scar tissue that forms or the slow deterioration that happens in the retina for patients who have for macular degeneration. And so the trend is looking for different medications, maybe working differently than what we're using now in combination with what we're using now to get better results.
Great. What are some of your most popular procedures?
Yeah. So because we are a retina practice, we treat a lot of patients with diabetic retinopathy, with macular degeneration, and retinal detachments. So as part of that, sometimes laser is the right treatment. More and more, though, we're using less laser and we're using medications that we give directly to the eye that stop the abnormal blood vessels that are growing, stop leaking, stop bleeding. That's one of those two diseases are the two most common causes of people going blind, and a lot of people don't realize that.
What are some of the biggest misconceptions that your patients may have?
Yes. So the first thing that I want to get out there is that if you have diabetes, you should have an eye exam every year. Don't wait until you notice that there's a change. And that's the big misconception. And many people think, well, I'm seeing fine, I don't really need an eye exam. Well, the key is that you can actually identify things that are happening before they affect your vision. We can treat them and keep you seeing. You know, my whole goal with diabetes is you should have the same vision when you're 60 as what you have when you're 20, because if we get it early and treat it, that can happen. So many times the people who go blind, it's the ones where they didn't come in, they waited too long, and then when scar tissue develops, there's only so much that we can do. And I think for macular degeneration, the biggest misconception is, so this is a disease that happens in people later in life. They're struggling, they're trying to be able to live their lives the way they've always lived, read the paper, drive their car, read a book, enjoy life, see their grandchildren, and then they notice their vision starting to fail. And same thing with that, go in and have an eye exam, because if it is one of the forms that we can treat, we can keep people seeing. People who used to go blind, I'll have patients come to me who said, I just figure I've got this, I'm going to go blind, that's just the way it is. But actually, many patients who used to go blind, we're now keeping them driving, reading in their 90s. I have many patients in their 90s still driving and reading. So things have really changed and are getting better every day.
Great. So where in San Antonio can people find you specifically?
So we have two offices. One's on the west side of San Antonio in Westover Hills on Highway 151. It's 10439 Highway 151. And then we have another office that's in Schertz, that's just on the northeast side of town, just outside of Selma. And that's right on I-35. So 17319 I-35.
And what is your website?
Website is www.jeremiahbrownmd.com.
Thank you, Dr. Jeremiah Brown.
It's nice to meet you.
Thank you for being part of our Facebook Live video at an AAO conference.
Thank you.